Dr. Birx, thank you so much for being with us on Telemundo.
Thank you.
Talk to me a little bit about this virus. Do we know how it's going to behave in the future? The question so many have is how much longer?
Yeah, so that's a great question. So it's a new virus to us. It's a new virus, and it's totally new experience for us. And you can tell that in how no one has pre-existing immunity, and that's why it's moving so fast across America. It's also unusual that a lot of individuals we think may be asymptomatic or be able to spread virus before they have symptoms. And so this is also unusual. And of course, none of us have immunity to this virus because we've never seen it before. And so when you add those three things together, highly contagious, asymptomatic spread, and the ability that we don't have immunity, it makes for a very difficult situation in controlling the pandemic.
So no real projection, I guess, on when this curve will actually lower on a national level?
So we're seeing flattening of the curve nationally, but it's more difficult to interpret because outbreaks have occurred at different rates and speeds. So New Orleans has already moved through its peak and has very low number of cases. You know, the New York metro area is starting to flatten its curve. We even see some hopeful signs now starting in Boston and Chicago, but all of these cities and these large metro areas and every rural outbreak has a little bit different curve. And then the curve in Seattle is very different than any other place in the country because they were very early on put in very strong public health methods that really decreased their curve overall.
So, Dr. Birx, with this curve lowering on a national level, and clearly there will be outbreaks in different parts, but nationally that curve lowering, the estimated number of deaths in the United States has also been lowering through the White House. Is this a time to institute now an immigration ban?
I think the president is very focused on keeping Americans healthy. And so we've worked very hard, and Americans have worked incredibly hard from inner cities to metro areas to the suburbs to the rural areas to really ensure they're protecting themselves and protecting others. And I think it's been very clear that the president doesn't want individuals who could have infections from the outside coming into the country and spreading more virus at a time where we're really trying to still control it within the United States.
In effect, kind of the borders are closed already, right? I mean, it just seems like ban on immigration when we're actually looking for people to work on the fields, and the border with Canada is closed, the border with Mexico is closed, the ban on flights to Europe continues, China continues. So what is this?
I think it's just making sure that everybody is protected. And I've just been so impressed by the American people, no matter where they are, whether they're in Detroit or Chicago or New Orleans, really following both the federal and local and state guidelines to really protect themselves and their family. That's what's flattening the curve. And I think it's just ensuring that we continue to make progress. I'm very focused on the public health pieces and very much ensuring that the American people get the messages on that things are getting better, but we still have to continue to work every day to prevent spread of this virus.
Dr. Birx, the issue of testing continues to be a subject of some controversy. That includes new warnings from different labs and their techs that an alarming number of these rapid tests are inconsistent. How do we implement phase one when the issue of testing has still not been resolved?
So I think you're talking about two different kinds of tests. One of them is the diagnostic test, which is a nucleic acid-based test. And about 90% to 95% of that is done on what we call medium to high throughput machines. We only do about 50,000 tests a day or less on the Abbott IDs. So over 150,000 are on the high throughput and medium throughput. We haven't seen issues with nucleic acid testing if you do sampling correctly. So your test is only as good as the way you sample. Now, we have been very clear from the beginning that antibody and antibody rapid tests, particularly if they've not been studied and authorized by the FDA, should not be utilized. We see reports from around the globe that these have very poor sensitivity and specificity. No state, no public health department should be buying tests that have not been authorized, and it's why we have been slow in releasing antibody tests. Antibody tests will not be used primarily for diagnosis. They're much more of a surveillance tool and much more a tool about telling people if they've been exposed to the virus, they became infected and they made effective antibody, but they didn't know they were infected. So the people that were infected and were diagnosed with nucleic acid assay, we know they were infected. But they may be first responders and healthcare workers, and it's why in the federal guidelines for reopening America, we made it clear that healthcare workers and first responders, as soon as we have a validated antibody test that we feel comfortable with, should be utilized. And we're not quite there yet. So if you're utilizing antibody tests, you should be using it strictly for surveillance, but not be telling the individual that they clearly were infected or not.
And so how do you see America getting back to work? And what are the pieces that need to be in place so that people can essentially leave their homes and go back to work for the people that still have jobs?
I think there's two pieces that are critically important. One, each of the local or state areas should be meeting the gating criteria. And those, we only have 6, but those 6 are very important. And so every state and local government and every community should be asking, have we met these criteria? Secondly, every state and local public health department should have all of their data publicly available. And it's why I've called out the Florida site. Everybody should look at the Florida site, their dashboard, by zip code, by county, clearly the number of cases, the number of new cases, because an informed public will be a protected public. And I think all of us have an obligation to make sure that communities can see their data, what's happening in their community where they work, so that they can make decisions about how to protect themselves and their loved ones.
Dr. Birx, Latinos and African Americans have been disproportionately affected by this virus as they go back to work. How do you protect them?
Well, I think two pieces. One, I think many of our essential workers and many of our individuals who have been continuing to work in our large metro areas were in the Hispanic and African American community. And so they are the ones that have put themselves at risk. And I think we also have to really ensure that in the workplace, everyone is protected. And that's why there's also workplace guidance about social distancing, ensuring that you can take people's temperature, and ensuring we protect each other by staying home if we even have early symptoms so we can protect others. Also really making sure that that's why we talked about testing within our federal clinics that are serving the more vulnerable, to make sure that they have access to testing and make sure they have access to information of how to protect themselves. And we know many Hispanic and African American communities live in multi-generational households. And this is particularly important, that everyone is reading the guidelines about how to protect each other, even in multi-generational households.
Dr. Birx, thank you very much for being with us on Telemundo. Very much appreciated.
Thank you.